Welcome back, everyone. I hope you are feeling caffeinated and sugared up as is appropriate. We've only got about 45 minutes till lunch, actually. But in this next section, we want to talk about challenges. So as Fergus said, the whole point of this programme is to achieve things for the public benefit. So we do want to spend a bit of time mapping out, in a similar way that we did before, what are the challenges facing our society that we might actually be able to help with if we leverage that data. So it's not going to be the most uplifting segment of the day, but I do have a quick video to kind of do a bit of a start of a 10 of what are the challenges, and then we'll invite you to move around and do a bit more brainstorming.
Well, the international economic think tank, the OECD, has warned that the UK will have the lowest growth among the big group of 7 industrial countries next year.
Since the Second World War, productivity grew steadily. So by the mid-2000s, British workers produced as much in an hour's work than 5 of their counterparts 100 years earlier. But productivity stopped growing around the time of the financial crisis of 2008-2009. This sudden rupture is known as the productivity puzzle. Zoom in and it's clear there's been almost no growth since 2008. A worker today produces the same amount in an hour as someone 10 years ago. Had the pre-crisis trend continued, Britain would be over 20% better off.
Our lifestyles are crucial to our long-term health. We know the health inequality gap is increasing, but despite all of our best efforts, in certain cases, some patients are still slipping through the net.
Every winter, we're talking about an NHS in crisis, and every year really is worse than the last. But here's the thing, all this, it's before COVID. This is what happens when we add the next 3 years of data. A strange dip in 2020 when people stayed away from the NHS during lockdowns, but then a sudden rocketing rise. A&E waits are now 10 times worse than they were in 2011, cancer waits 14 times worse, and trolley waits 16 times worse than they were at the start of the last decade.
Every 3 seconds, someone in the world develops dementia. Today, there are 47 million people living with the condition worldwide. That's more than the entire population of Spain. In the UK, it's the single biggest cause of death for women and the second biggest for men. Every year, friends and families spend 150,000 years caring for loved ones with the condition.
Analysis by the Royal College of Emergency Medicine, shared exclusively with this programme, shows the sheer scale of the problem. This line represents those with mental health problems waiting more than 12 hours in emergency departments between 2019 and 2022. And this one represents all patients. So mental health patients are more than twice as likely as others to wait more than 12 hours.
For decades, it's been a taboo subject, and in some communities, it still is. If you're a black man in Britain, you're 17 times more likely to be diagnosed with a serious mental health condition than if you're white. It's a startling statistic.
We've seen a real increase. We've seen a real increase in demand for mental health services. And we've seen a real increase, actually, in people we've never met before.
In the UK, there has been a significant lack of social mobility since 1945. As wealth inequality has remained high, there hasn't been much change in how well British children are doing at school. In a 2019 report by the education coalition Fair Education Alliance, pupils from disadvantaged backgrounds in the UK lagged their peers by more than 8 months in reading, writing and maths by age 11.
Children from persistently disadvantaged backgrounds are 22 months behind by the time they finish their school career. Small progress has been made in helping some children almost beat the odds and overcome the barriers that face them, but the systemic underlying factors of our education system still remain, which mean we're not ever reaching the most persistently disadvantaged.
A report by the UK Met Office says the impact of climate change is already being felt across Britain with increased rainfall, sunshine and temperatures.
There is a lot of evidence that the intensity, frequency and duration of droughts, summer droughts, are increasing due to global warming.
We expect to see more frequent and more severe weather with climate change, and we do expect that to increase the risk of flooding for many people across the country.
We will ask you to shuffle around a bit, and we'll make sure that you do so. But what we'd like you to do is, again, have a group discussion about what are the major societal challenges affecting the UK populations and its institution. And we'll ask you to do a similar kind of mind map activity that you'll all be used to by now. But for example, within health, what are the mental health crises? What do young people specifically face? And the idea will be that we'll get kind of granular problem spaces that then we can think about in a quite tractable way. What are the data applications that we can use to solve those problems? Does that sound clear enough? Great, and you'll see that we've repapered your table, so you've got a brand new sheet to work on in terms of challenges. So please do have a mix around, and we'll give you up to 25 minutes for that. Okay, thanks everyone. I hope you've got lots of challenges written down. As before, I'll ask a couple of people to maybe share back, but not everyone, and I've cruelly asked someone on this table to go first, if that is okay.
Cruel's a word for our group, but I'll do the very best I can. The challenge was looking at the challenges that emerged for us in regards to looking at how we use data. They're huge, we know the big areas that really affect everyone, and for some communities these things are long lasting. So we're talking about climate change, we're talking about unemployment, we're talking about health access, we're talking about workforce, we're talking about overcrowding, respiratory issues. For some communities that's the story they're told all of the time, all of their lives, because your outcome will be A, B, C, D. The challenge we have is to look at what lovely modifiable factors. We know what the challenges are. We can all talk about them quite easily, but we need to think about what we can do about them. We know what the unintended consequences can be, but how do we manage these? We need to look at the positives in these things. Big thing we talked about really was that issue about prevention, really key for us. It's a big area that we need to pay attention to that can help with independence. Look at the issue around unemployment, workforce issues. And we also have to think about the wider workforce issues as well. Why are there pressures in the NHS? You know, what's going on with waiting times? So the big thing for us was about modifiable issues. You know, what are the challenges? What do we need to do about them? But we have to remain hopeful and find that positivity, because in the long term, there's going to be changes in politics, political agenda that can influence all of these things. So it's about finding those nuggets in these challenging times. Yes? Okay.
All right, thank you, well said. And if I can maybe ask one more table to report back, and this one is closest, so I'll go for you guys.
I think we had three broad areas, and probably cost of living, net zero / environment, and health. They were our three broad areas. And then you can break it down into many sub-challenges that could be addressed. I mean, like food security is linked to environment, net zero, future health prediction, you know, to inform sort of government spending and effective government spending. Cost of living, I mean, that can bring in data from many different aspects, and trying to figure out how to address those challenges in the future. Reducing inequality was another major sort of theme, and that's, I guess, a product of many of those greater challenges.
Cool, and that is it. We are now breaking for lunch, so it's all over there. We'll reconvene at 1:15. Dear colleagues, anything that we should say at this point? Great, okay, see you later. Thanks, everyone.